This next movement is going to be something to improve cervical extension or the ability to look up. Just to talk before we do it, most people, when I look at their neck, right, their issue is that their shoulders are rounded forward and their head's a little bit forward, and there's this prominent curve and bump right here. And then when they go to look up, a lot of it's happening just at this crease without any of that motion coming down through their upper thoracic spine so they can get the rest of that looking up direction. So this position off the edge of a bed or table is going to be very helpful to try and gradually progress into cervical extension, trying to get it to happen more at that upper thoracic, the lower cervical area where a lot of people are stiff right here. So I'm going to use this table, but at home a bed may actually be more effective because you'll have a little bit more of a gradual slope versus this hard table is more sturdy, so my head's just going to be kind of dropping off the edge. I'm going to use a pillowcase for some support, right? Now, the closer I get to this edge of the table, the more my head is automatically going to start to fall into some extension, right? The gravity, the weight of my head is just going to fall off the edge. So I'm going to start, like I said, if it's a bed, it'll give me more of a smooth decline. And I'm going to take this pillowcase behind my head, right behind the base of my skull, and I'm going to use this to assist me, right? So I'm going to tuck my chin, kind of looking down towards my sternum as I lift my head out of the extension. And then keeping my chin tucked as long as I can. I'm going to come back and I'm going to let my head rest into a little bit of that extension. And then once again, my chin will tuck. I'll use my hands to assist in the lifting of my head. I'm not lifting my head so far that I'm pulling it way up towards my chest, just enough to bring it back beyond neutral, and then trying to keep that chin down a little as I go back. It's worth noting that when I'm doing this chin tuck, I'm not necessarily jamming my chin as hard as I can. It's just a very light movement of taking my chin towards my throat. So as I come up, I'm trying to keep this chin a little bit tucked instead of letting it just hang back like this. And then if that's going okay, the further I slide towards the edge of that surface I'm laying on is going to let me go into a little more extension. Now, one common complaint with looking up is that people will feel pinching or compression in the back of their neck. So what I'm looking for here is that it's okay to feel a little bit of that as long as it's getting better as I do it. But if I go to this position and I do everything that I talked about, pillowcase behind the base of the head, and I tuck my chin and I come up, and then as I lower down, I want to see, even if there is some of that, does it get better as I do it? But if every time I'm feeling that pinch or compression there and it doesn't feel very good, or if I'm getting numbness in my hand especially, I'm going to scoot back down because I want to try and stay in a range where it's pretty comfortable. And then every time I come back to this type of movement, I can always try and push the limits and go a little further. So ideally, I would say, okay, this is fine. And then this would take me further back. And then I could really get that head off the edge, and now I'm going to be dropping almost all the way into that looking up direction. And as I get to this point, it's the same idea. I have the pillowcase for a little bit of support. My chin is tucked. I keep it tucked as long as I can, and then right about here, I have to lose that tuck, and I let my head just drop down as far as I can go comfortably. And then I let the pillowcase do the work. Chin tucks first as I come back up. So I always want to get that little bit of a chin down movement as I go to transition out of this extended position. If this does bother the shoulders for any reason, sometimes it feels a little better to be a little wider. So this will be a little less pressure on the shoulder if you feel you want to pull your hands further apart. But it is important to have some support on the back of your head if you can tolerate it.